We also will run a transcript today's session. We have individuals still coming in. Be patient with us, please. Good afternoon, everyone. We are now recording. Feel free to introduce yourself in the chat. Alrighty. Welcome to our February 12th CHW Learning Circle. My name is Angela Fields. I'm a community health worker certificate holder since 2008. I'm also the Associate Executive Director of the Minnesota Community Health Worker Alliance. Today's session, we're going to start a little bit out of order, but I just wanted to make sure I get that out there just in case anyone has to leave. The Minnesota Community Health Worker Alliance will be launching this year's CHW Leadership Institute. And the Institute will, the start date of the Institute is April 8th, 2025, and it will run through September 2025. I've also included in the chat the link to our website where you could apply. I also periodically throughout our time together will be entering that information in the chat as I monitor the chat as our guest facilitator conducts the presentation. The Minnesota CHW Learning Circle is a peer learning circle meeting that generally is held on the first or second Wednesday of each month from 3 to 4:30 p.m. remotely. It's open to all CHWs, provided free of charge by the Alliance. The mission of the CHW Learning Circle is to provide an avenue for CHWs to connect, learn, and tap into one another's knowledge through discussion. The Learning Circle is hosted by the Alliance, which lays out the platform of clear organizational goals and objectives for the advancement of those in the CHW profession. The vision of the Learning Circle is to create a workforce that encompasses the voices of those in the CHW profession and to support our philosophy and vision of nothing about us without us. So the purpose of the CHW Learning Circle is it's a monthly capacity building event for CHWs, facilitated by CHWs. At the circle, CHWs learn with their peers, and we explore issues in our field. The circle provides an environment in which CHWs can share successes and concerns and gain perspectives of their workforce alongside of their peers. CHWs, as we know, work in multiple environments, and we enjoy getting together and learning with others as a way to share our experiences in our roles. We invite guest speakers to provide informal and formal training from experts on current issues around healthcare and the field. Today, our topic is the power of stories, how CHWs can shape and engage in public health policy process. The presentation description will be CHWs play a vital role in healthcare systems, advocating for their patients and communities that we serve. But did you know that stories and experiences of CHWs can directly influence public policies? This session will explore how CHWs can become more powerful advocates within the policymaking process, from the initial idea to the final implementation of the issue. In this session, we will learn about the state legislative process and how it impacts health policies, the power of advocacy and how to use it effectively, strategies for contacting lawmakers and decision makers, how to craft and share your personal stories to make an impact, ways to engage with elected officials, the media, and other stakeholders. As CHWs, our voices matter in shaping the policies that affect the communities we work within. By learning how to share our stories, we can play a significant role in advocating for the changes at local, state, and national levels. Today we have Emily Myatt. Her pronouns are she, her. Emily is the regional government relationship director at ACS CAN. In that role, she develops and manages local and state policy campaigns, is the primary Minnesota lobbyist for the organization, and oversees state campaigns in Iowa and Indiana. Emily has worked on successful policy campaigns to increase federal cancer research funding, expand paid family and medical leave, improve access to affordable cancer care, and fund cancer prevention programs. She sits on the Minnesota Cancer Alliance Steering and Policy Committee and is a co-chair of the Minnesotans for a Smoke-Free Generation. Emily was named the 2023 ACS CAN Field Government Relations Professional of the Year. Emily received her Bachelor's of Art in Political Science and Legal Studies from the University of Wisconsin-Madison and is a 15-year cancer survivor. When Emily isn't thinking about public policy, she is knitting, reading, or hiking with her husband and 2 dogs. And without further ado, I will turn it over to Emily.
Thank you, Angela.
Thank you.
Good afternoon, everyone. It's nice to be here with you. I'm going to share my screen. And while I'm doing that, I just wanted to kind of share my style of presenting. I am very much an informal type of presenter, and so very much welcome folks sharing questions as you go. I'm going to pull the chat box over here so I can see the chat as I'm presenting, but also feel free to just come off of mute and ask questions. I think all of us might have a variety of levels with the public policy process and like how comfortable we feel, how much experience we have. So I want to make sure everybody takes away a little bit of something from this. So again, feel free to just ask questions as we go. So I'm going to share my slide. And all right, here we go. So like Angela said, my name's Emily. I use she, her pronouns, and I am the Regional Government Relations Director for the American Cancer Society Cancer Action Network. And I'm really excited to talk about how CHWs can and should be part of the public policy making process and how you can navigate the system with supports from me, from the Community Health Worker Alliance, especially Angela, on making things like advocacy possible. So for today, we're going to walk through and review the legislative process. I'm very much going to focus on the Minnesota state legislative process. And then we'll talk about how to contact your lawmakers. We'll have a little exercise on how to look up who your state and federal lawmakers are, just in case you don't know, which is totally fine. Lots of different people represent us at all different levels of government. So there's no judgment on if you don't know who your lawmaker is. We're going to discuss the power of a story and the power of grassroots organizing. And then we're going to talk about how to craft and share your story with multiple audiences. And we'll end the day with a call to action as well. I first want to get started by sharing who ACS CAN is. ACS CAN, or the American Cancer Society Cancer Action Network, is the nonprofit, nonpartisan advocacy affiliate of the American Cancer Society. That's a very IRS-friendly way of saying we share the same mission as the American Cancer Society to end cancer as we know it for everyone, but we do it through public policy. So we work at the local, state, and federal level to connect with decision makers about the work that they're doing and how it can really impact the lives of cancer patients, survivors, caregivers, providers. And we also have a judicial advocacy program as well. So we have a staff attorney who does a lot of pro bono work and will go to the Supreme Court, for example, and submit amicus briefs. And I will say we do our work through grassroots organizing. Our power comes from stories and experiences of patients, survivors, and families. Oftentimes when we think of political power, we think of money. And ACS CAN, we don't give money to elected officials. We don't give money to candidates. We don't endorse candidates. We bring real life experiences of people. And so I'm really excited to talk to you all today about how you can kind of join that work and build on the work you're already doing to be advocates for the folks you serve. So let's start a little bit with what's happening here in Minnesota. There's a little bit of snow, but it doesn't look as beautiful as this photo. 2 weeks ago, they had a rail jam, Red Bull did, where they had kind of a ski rail and an event where folks were like snowboarding and skiing and doing tricks down rails. And there was a huge pile of snow that they had bussed in. I was like, wow, if that isn't sad that that's what it takes to get a little bit of snow is people driving in snow. But for now, it doesn't look quite as beautiful. So here in Minnesota, you are represented by one state senator and one House member. So in Minnesota, they go to St. Paul to represent you. There are 134 members in the Minnesota House of Representatives. There's 67 members in the Minnesota Senate. There are 67 Senate districts, and that's kind of driven by geography and population. And so for each Senate district, there are two House districts, the A side and the B side. So when you look up who your state lawmaker is, it might say you live in 63A or 63B, and that's to notate which side of the district, the Senate district you're on, and that corresponds to your House member. And then I did show two pictures here of what the buildings look like. If you haven't been to St. Paul, there's the Capitol, of course, which is beautiful, but then the Senate also meets in this Minnesota Senate building here, and that is open to the public. You can walk in, you can attend committee hearings, you can schedule lawmaker visits, and then the Centennial Office Building. That's new this year. The Minnesota State Office Building is closed for construction, and so they moved all 134 House members, or 133 right now, over to the Centennial Office Building. And I will say it is not as people friendly as the other building is. There's a security desk. It's not super friendly for folks to visit and to go up because you have to have somebody come down and escort you upstairs. They're working through the kinks, but I know that elected officials, leadership in the House are hearing from a lot of us about this needs to be easier for the people to come to their house and to meet with their lawmakers. That's my editorial on the process right now in the Minnesota House. And then when it comes to who represents you in Washington, D.C., these are members. Oh, there we go. There are 35 members in the U.S. House of Representatives. There are 8 congressional districts here in Minnesota, so there are 8 members of the U.S. House, and there are 100 members of the U.S. Senate. And that means every state, all 50 states, have 2 U.S. senators. So every person is represented by our 2 U.S. senators. So if you live in Minnesota, sorry, my dog's barking. If you live in Minnesota, you have Senator Smith and Senator Klobuchar, these 2 women here. And then here are all of the members of the U.S. House of Representatives. Again, that's divided by where you live in the state and geography and determined by population. The newest member of the Minnesota delegation is Senator Kelly, or sorry, I'm used to calling her Senator, U.S. Representative Kelly Morrison, who served in the Minnesota legislature. She's a doctor. She's an incredible champion for public health, and I'm looking forward to working with her in this new role. So I want to take a couple of minutes just to let everybody have a little bit of time to stop and look up who represents you in the legislature. So I have a QR code that you can scan and it'll pull up the website, or I've listed the website below, and maybe we can copy and paste it and drop it in the chat. And so I just wanted to take a moment for everybody to type in their home address and look up who represents them. And then if folks feel comfortable, feel free to come off of mute and share who your state lawmakers are, or who your federal lawmakers are, or feel free to share that in the chat. Kimberly, I just posted it. How's it going? Were people able to look up who their members are? All right, so Amy has Representative Davis, Senator Eichhorn, and then US Rep Stauber, and then of course Klobuchar and Smith. Thanks, Amy. I really like seeing too where everybody's calling in from in Minnesota. This is great. Awesome. So we've got Representative Datseth, Senator Rarick, Representative Stauber. Hello, my outstate friends. Thanks for joining. All right. So we've got Representative Cleavorn, Senator Westland. You, Sean, have U.S. Rep Morrison, Rapinski, Miller, Finstead. Great. Peggy Bennett, Jean Dornink. This is wonderful. Cool. All right. Amanda, Representative Rapinski is a freshman member this year, and he sits on the Health and Human Services Committee, which is important. That's a issue that a lot of our work will go through. Same for you, Vanessa. All right. I'm going to keep moving, but feel free to keep dropping things in the chat. This is wonderful. You all have, it's great to see the spread of representation here. All right. So this chart is a little chaos. It is a really detailed process of how a bill becomes a law. And the really funny, frustrating, ironic thing is that it doesn't always have to follow this process. At any time, lawmakers can vote to change the rules. They can kind of skirt around key deadlines or committee stops and kind of stretch out or shorten the process to really reflect the decision of leadership or the body. But generally speaking, this is how a bill becomes a law, but let's streamline it out a little bit. So a bill always starts with an idea. I, Emily Myatt, cannot introduce a bill. I might have an idea. Angela and I might have really good ideas. The Community Health Worker Alliance might have really good ideas about how to streamline reimbursement for community health workers, to improve health insurance coverage for community health workers, to improve grant funding for community health workers, but we can't introduce those bills. So we have this idea, and what we try to do is to find a lawmaker who will author and champion the bill for us. So let's say we take our bill to Representative Liz Ryer, who covers Egan. She sits on the health committee, and I'll say, Representative Ryer, we really need your support on a bill to improve funding and reimbursement for community health workers. And she says, yes, I love that. That's amazing. Angela and Emily, thank you so much for this bill language. We will work then with what's called the revisor's office. That is the office that really specializes in Minnesota state statute. There's books and books and books of state statute, and the revisor's office will work with us to make sure our language, our idea, fits properly into state statute, reflects the language common in state statute, and really kind of blends into existing law. From there, we will get what's called jackets. So in the Minnesota House and the Minnesota Senate, we are still very old school, and that before you get a bill introduced, you have to get physical signatures. So you get what's called jackets. There's a green jacket and a yellow jacket, one for the House, one for the Senate. And sometimes lawmakers will give it to me as a lobbyist, and I'll say, okay, thanks, you sign the first spot. And then I'll walk it around and I'll say, hi, Representative Bierman. I'm working on a bill to improve funding and reimbursement for community health workers. Would you be interested in co-authoring this? And he'll either be like, yes, of course, or no, Emily, no thanks. And then he'll initial in the second spot. In the House, you can have up to maybe 30 or 40, I should know this. You can have a number of co-authors signing on in support of the bill. In the Senate, only 5 senators can sign on as authors or co-authors. It's really good. A strategy that I use as a lobbyist is to have a bill introduced with bipartisan support. So Democrats and Republicans, right? It shows that this is a united issue. It isn't controversial. That's always really important because from my perspective, I'm always wanting to work with both sides of the aisle, regardless of who has the majority or the minority. And then you also want to have as many bill authors as possible because it shows broad support. And sometimes it's really important to think about the strategy of who your bill authors are. Do they sit on a committee that a topic will go to? So when we think about community health worker funding and reimbursement, that'll probably have to go to a health committee. Might have to go to a commerce committee depending on what types of insurance companies we're looking at for reimbursement. And so you want supporters of that bill from those committees. So when it comes time for a committee hearing, that's that next step here, you've got supporters on the committee and ready to go. Committee hearings are really important part of the public engagement process. So there's hearings happening right now in the Minnesota House and Senate on specific bill topics. And those legislative committees will post sometimes with a day notice, sometimes with a couple days notice. We're going to be hearing bills XYZ on this date. And then that's when they welcome public testimony, public comments, public support. Through the committee process at ECS CAN, we try to drive in as much grassroots outreach as possible. So we want advocates who have lawmakers that sit on a specific committee to reach out and support or to express concerns about a bill on the agenda. We also want to think about who our testifiers are, who are going to tell stories to remind lawmakers that what they're looking at has real life impact and consequences on Minnesotans. And then we want to also think about okay, who sits on the committee and do we have testifiers to influence maybe people who might have concerns or might be opposed to our issue? So there's so much strategy that goes into trying to shepherd a bill through the process and have a really successful hearing. Or very often, this is where we try and kill a bill. That's what we call it, we're going to kill a bill, right? And that's when we try to put as much out there to say, this is not right, there's room for improvement, or we need to be done. But let's stick with proactive agendas for now, because it's always more fun to push forward a bill than try to defeat a bad bill. So after a bill has gone through all of the committee processes or the committee steps, it will go back to the full floor. And that's where the body of the House or the body of the Senate will vote on an issue. Now, you have to have a bill introduced in the Minnesota House and the Minnesota Senate. So your bill will go through multiple committee stops in both bodies, and then it has to go off the floor in both bodies too. Now, say our bill to improve funding and reimbursement for community health workers goes through as introduced in the House, but in the Senate, a couple amendments are added. They made a couple of language tweaks. So now we have two different bills, but we can't send two bills to the governor to sign. So either lawmakers behind the scenes will work to negotiate and pick one bill. Okay, we're fine with the Senate version. We're going to pass the Senate version off the House floor and then send it to the governor. Or they meet in what's called a conference committee. And that's a group of House members and Senate members who come together to kind of work through differences of the same bill. They come to compromises and solutions to have one agreed upon bill that then they can pass off of both floors and send to the governor. So every step of the way is an opportunity for you as a community health worker to engage, to share your story, to talk to your lawmaker who represents you. Remember, we did our lookup exercise, or to meet with leadership, to meet with committee chairs, to meet with other committee members. Like every step of this process is a way for community health workers to engage and to make sure your voices, experiences, the voices and experiences of people that you serve and support are heard as well. I'm going to pause there to see if there's any questions about the legislative process or how a bill becomes a law. I know it can seem a little overwhelming, and I threw a ton of info at you. Okay. So let's talk a little bit more about policy priorities and kind of the policy process. So we talked through how a bill becomes a law, but what does that actually look like in reality? So for ACS CAN this legislative session, we're focused on several different things. The first is around funding for the Minnesota Department of Health and the Department of Human Services. We know that there's lots of federal threats right now to funding, important funding programs, grants, work that's happening at our state. And so we want to protect our state budget. We're also working to preserve medical assistance in Minnesota Care. We're working on some legislation that would buy back the debt of Minnesotans across the state. So a medical debt reset to really address financial toxicity. And then, of course, we're working with Angela and the Community Health Worker Alliance and other groups to take a better look at what does reimbursement and coverage look like for community health workers through Medicaid. ACS CAN comes at this from the lens of patient navigation and making sure that our Medicaid program covers patient navigation services. And as part of that, I knew that so many of you have been doing work as community health workers or community health workers in training to work with elected officials, to work with agency staff to improve the reimbursement process through Medicaid. And so I came to Angela seeking guidance and wisdom to make sure I wasn't unintentionally causing disruption to community health worker reimbursement, and instead saying like, okay, ACS CAN has this bill we want to work on. You all have opportunities for improvement and reimbursement. How can we come together and work together to pass a bill that works for everyone? So I'm going to pause for a second and I want to show you all kind of the state legislative website. So I'm going to drop out of this PowerPoint just for a second, and I'm going to switch over to my internet browser. So this is the Minnesota State Legislative website. There's a lot here. So I want to show you the three things that I tend to look at when I am doing my job. So first here, I go to this bill tab. And this is where I can browse the bills that have been introduced in the Minnesota House and in the Minnesota Senate. And as you can see, since the Senate first started meeting on January 14th, but the first day was the 16th, here's all of the bills that have been dropped. Now that's a lot, right? We're already up to 1,254 bills just in the Minnesota Senate. So you can also search for bills by keywords. So this is a way to browse Senate bill intros, and I like to search for keywords. So oftentimes I'm like, okay, is there cancer? What about community health worker? And you can search to see if there's any bills that have that keyword of community health worker in it. Now, sometimes it's not totally accurate. It'll just be like, here is health, the word health. And you're like, it's not what I was looking for. But for example, earlier this week, I browsed bill introductions and I found this bill. Where is it? I was just looking at it. From Senator Marty that looks at kind of a piece around care coordination and really centering around patient care. And so you can kind of click and see, oh, this is what the bill language is. So the bill status shows the bill number, and that's how you can find the language. And then we'll go. So let's just say, let's click on this bill. So this bill was introduced. This tells me when you look at a bill number, it tells me who are the authors. Remember, in the Senate, we can have up to 5 authors. And it tells me where is it at in the process. So when the bill was first introduced, it was referred to the Commerce Committee. But then they did a motion to say, nope, we're going to have it heard in the Health Committee first. So that's your way to know that at some point this bill will be heard in the Health Committee, probably. Now, not every bill introduced has a hearing, but it's a really easy way then to navigate. And then you can, from there, click on the Health Committee. So I browse bill introductions, I look for keywords, and then I also look at the schedule every day of the Minnesota House and the Minnesota Senate. So I'm going to click on the Joint Combined Meeting tab, and this is what tells you all of the committees that are happening, and it's your opportunity to see the committee agenda. My internet apparently is not very happy with me and doesn't want to go to the place I want it to. So let's get there a different way. Okay, here's the calendar. So this calendar here, this is an example of what it looks like. So say we wanted to see what's on the agenda for today, Wednesday the 12th, and then you can see here is what's on the committee agenda for Health and Human Services. Now through the website, you can sign up to get bill updates. So say we wanted to track that bill, you can set it up so you get alerts to your email every time the bill is moving or scheduled for hearing, which is really helpful because it is a lot to navigate. I do this full time and it is a lot to navigate, and I inevitably miss things too. So this is your way to look up kind of bill intros in the House and in the Senate. You can look by keywords, and then this committee schedule or schedule here is a really helpful day because it tells you what committees are meeting, what the topics are, and how to watch it. You can either watch on YouTube or stream online, or you can go in person. I know this is a lot of info and it's a little wonky, but I always find it helpful to better understand how I can engage in a process. So if I am not a lobbyist, how can I engage in something as a citizen, as an advocate? And this is a really helpful tool to help track things.
It's helpful for me to see it in real time. Instead of clunking around the website, you can go directly to those spaces. So now I recognize that page. So that's helpful to look up the bills specifically
Perfect.
of what I'm looking for without having to go through all the weeding through.
Yeah, I'm glad to hear that. And again, like the House tab here is where you can look up all the House members. So say your representative is Representative Badge, so we can click on that and it'll take you to her profile. So it'll tell you who her legislative staff is, how to get in touch with either Representative Badge or her staff. It also tells you what committee she sits on, what's her background. Also, are there any bills that she's introduced? And you could click. So there's so much knowledge and information, but it can be really hard to find what you're looking for. And I'll just say that, like, I'm very much happy to help folks kind of navigate this process too. And then I also want to show DC. So this is our Congress. This is what's happening in Washington, DC. It's just congress.gov. The same thing here. So you can look up who your lawmakers are. Right here shows you the current legislative activities. Is the House in session? Is the floor in session? What committees are meeting? What's being discussed that day? How can you view it? And you can also do the keyword search here. So I'm going to do community health worker on this tab because I want to see what's happening in Congress. And now we can see that there's several bills. Now, this is from an old Congress, right? So it's from 2023, 2024. So at this moment in time, it doesn't look like any bills have been introduced yet pertaining to community health workers, but you can kind of see the history. And then when you click on the bill, just like we did in Minnesota, it gives you more info. It looks different, but the same thing. So you can see the bill text specifically through here. So what does the bill actually say? You can see where is it at? What's the process? Okay, so it's been heard by the Committee on Finance. That's important. Have amendments been added? In this sense, it's a little bit easy to track because it's all in one place. And then you can also see who co-sponsors it in addition to the bill author. So again, just another way to navigate all of the stuff that's happening at the federal level and how you can use the website to better track and triage things. Okay, I'm going to switch back now to the PowerPoint. But any questions on navigating those websites? Okay. And then I'll say, oh, go ahead, Angela.
I was just saying, thank you for that.
Of course. And from the state legislative session, like these are the policies that I'm going into with like, I want to work on these things. I want to advance these things. Policies take so much time and it can be really exhausting. And so while I think I might be going in to work on issue A, maybe 5 bills are introduced that are either really great or really terrible, and then I have to pivot. So it's a key strategy of advocacy work and legislative engagement is staying flexible and open to things that change because ultimately some of these things are beyond our control. So our federal action, our federal agenda for 2025 is really focused on preserving funding for prevention programs. I think about the breast and cervical cancer early detection programs that come down, that funding comes to our state to provide no-cost screenings for individuals with breasts, with cervixes, right? Like this is so important. We're also going to be preserving funding for research at the National Institutes of Health, the National Cancer Institute. That's money that comes back to our state. And we want to preserve funding for Medicaid and defeat any attempts to weaken the program or add barriers for enrollees. And again, we already kind of talked about that congress.gov portal. So I can talk about public policy all day because I'm very nerdy, but let's talk a little bit more about how advocates fit into the public policy process. I first want to talk about the difference, and sorry, this is getting cut off here, the difference between advocacy and lobbying. So advocacy is raising an awareness and educating about an issue, but it also can be taking a position on a specific cause or proposal. Being an advocate means you may have conversations with elected officials or community decision makers or community partners about an issue, speaking in support of, arguing for a cause. Oftentimes it's defending or defeating things, and it can involve getting support from others, right? When we talk about grassroots organizing and building capacity, it's building our people power and reaching out to others to get their support and involvement in the work. Lobbying is a little bit different and that involves direct communication with policymakers. Now, advocates may also do that, and I'll add the extra layer that lobbying is defined differently in every single state. So in Minnesota, there's specific regulations and definitions around who and who isn't a lobbyist. So a lobbyist is an individual engaged in the public policy making process that either is paid more than $3,000 a year to influence legislation or administrative action, or pays someone to do that $3,000 worth of administration or influence or whatever. I am paid to do my job. I am paid to be a lobbyist. So I am a registered lobbyist through the state of Minnesota. So I think sometimes, especially if we work at nonprofits, there's a real concern about, am I going too far? Am I crossing the line between advocacy and lobbying? And the understanding how lobbying is regulated in Minnesota is a really helpful way to understand if you're crossing that line. But advocacy, educating folks, sharing your experience, making sure lawmakers have all the information in front of them as they're making a decision, making sure your experience is heard, that is everything you can do in the wheelhouse of an advocate. I'm going to pause here and I want to know, have any of you ever met with a lawmaker? Feel free to put it in the chat, come off of mute. That's all good.
I always kind of pause here because I like to hear the voices of others before I chime in. Oh, here we go. There we go. Hey,
Yeah.
Brenda. Whenever
Sean,
I heard the term, oh, it was a question. Whenever I've heard the term lobbyist, it was never in a good way. LOL.
Sean, that is so fair. Um, I think on TV, we often see lobbyists as like white dudes in suits that are like advocating for big oil or the tobacco industry. And like that exists for sure, right? Like there are those kinds of lobbyists. But I will also say I work with lobbyists that are social workers. I work with lobbyists that come from, they were a doctor or a nurse and they decided to become a lobbyist. I'm a cancer survivor and I lobby for cancer patients and survivors. So a lot of us do really come at this, and I would say most of us, with pure hearts, with pure intentions, because we believe in something. And I love my job because my job is working with volunteers and just real Minnesotans and making sure they find their power and come to the Capitol to share their power. So, like, I think lobbyists has this perception, but oftentimes lobbyists are just like really nerdy people who want to make the world a better place. And then Vanessa says that yes, you and Nancy both have met through the Land Stewardship Project. You met with U.S. Representative Finstead and your local reps. So I love that. So if you haven't met with a lawmaker, we're going to talk through kind of what that looks like, strategies to do that, and maybe tips and tricks for success. So, like I talked about, my work is all about shifting the balance of power. And so when I look at this slide, um, there it is very overwhelming to engage in the legislative process. It is designed to empower some people and disenfranchise others. And it can be so overwhelming when we all have issues that we face every day in our careers, in our communities, as organizers, to figure out like how are we going to tackle a problem? Because sometimes it feels like the problem is chasing us, right? The big fish is chasing all the little fish and we're all feeling overwhelmed. Grassroots organizing is all about us coming together collectively to take on that problem, to take on the issue, to tackle the issue and the problem. And so at ACS, can we use the direct action organizing model to really look at how are we going to shift the balance of power? How are we going to accomplish our shared goal? And we do that through advocacy. And so here are some examples of advocacy. So you can testify at a city council hearing. You can do electoral work. So you can educate candidates on issues you care about. So before they even become elected officials, you can educate the candidates who are running to represent you, who community health workers are and what you do. If somebody comes and door knocks and says, "Hi, I want your vote in November," you can be like, "How do you feel about community health workers?" Right? And that's a really easy way to like kind of shift the conversation and make it about you and your need. I love, Vanessa, that you all were at Smoke Free Gen Day at the Capitol. That is one of my most favorite events. And so here's a group of students speaking to the media, talking about their kind of involvement in commercial tobacco prevention and treatment through a press conference. So you can tell your story, you can be an advocate through the media. You can sign petitions, right? Simply signing your name to something shows that you are in support or you have concerns of something, and that's adding to power in numbers. You can attend a rally. Rallies happen at the state capitol, they happen out in DC, they may happen in community outside of a lawmaker's office. Rally, again, is a really important way to engage the media and elected officials and community to talk about an issue. You can meet with elected officials. So here's a group of folks meeting with Senate President Bobby Joe Champion. And then we also have this picture here, and this was just from last week, of advocates meeting with Attorney General Keith Ellison. So sometimes our advocacy is not just with the legislature, but it's with other elected decision makers like the Attorney General, like the governor, who might not be passing the bills themselves, but are certainly influencing the process and can stand up for Minnesotans. So, when it comes to advocacy, what can you do? And really, the power of advocacy is storytelling. It's sharing and lifting up that lived experience. And I always want to remind everybody that, like, you are the expert of your story. You do not have to be an expert in a bill or in the policy process. I know I showed you how to navigate the website, but like, you don't have to be the expert in that. You are an expert in your lived experience. And you can tell your story in several ways through email, right? You can email your lawmaker, you can call your lawmaker on social media, on X, on Instagram, on Blue Sky, on Facebook. You can tag your lawmaker in posts. You can comment on things. My pro tip there is don't ever do anything in all upper caps, because I feel like anytime you see somebody using upper caps, you just kind of shut down, right? And you're like, no, I'm just going to keep scrolling. I will say social media is not always the best way to have a conversation, especially policy conversations that have a little bit of depth or nuance to them. But social media is a way to tell stories. You can tag your lawmaker, hi, so and so. My name's Emily. I'm a 15-year cancer survivor. This year, you can help patients and survivors by passing Bill X. That's a really good way to utilize social media because you're also educating the public. You can write a letter to the editor. Lots of newspapers still have letters to the editors. Lawmakers every day will look at the newspapers in their district to see what people are talking about. Are they being mentioned? Are there bill numbers that people are talking about? So letters to the editor is a great way to engage media, to educate the community, and also to do a little public targeting of a lawmaker. You can tell your story in person, in front of a legislative committee by testifying, or at a press conference. Now, this isn't everything, but this is sometimes when I think of like the gold standard of like all the different ways that are most common, this is how we do it. Our stories can be incredibly personal. They can bring up emotions, they can create frustration or anger or sadness. And I always tell my folks that like emotion is good. Emotion is how we as humans connect with each other, right? It's like that real empathy connection because it finds those connection points. And so we have a tip and kind of a tool for how to tell a story, how to tell your story with a lawmaker or elected officials, to kind of help folks prepare for that potentially emotional thing. So your story is always who you are, where you're from, what you want, why what you're talking about is important, and how to make the ask. So if you're having a conversation with an elected official, you want them to do something, right? And that's sometimes the hardest part, is to make the ask of them. So when you're thinking about your story and how you want to tell your story, there's some questions to have in mind. Who's your audience? Are you meeting with your lawmaker? Are you meeting with maybe the Speaker of the House? Are you meeting with the governor's office? And you want to think about why they care about an issue. So if it's your lawmaker is going to want to know an issue that's impacting their constituents, the people who elect them and vote them, or maybe not vote them, but put them in office. You want to think about, what do you want them to understand about what you're telling them? If you're talking about the importance of Medicaid, for example, what do you want them to know about Medicaid? If you're talking about the importance of reimbursement for community health workers, what do you want them to understand about that? How do you want them to feel? That's really important. Sometimes people don't always remember what you said, but they remember how you made them feel. What do you want them to do? Again, that ask is so important. Why are we having this conversation? What do I need you, lawmaker, to do for me? And then, of course, how much time do you have? So much of my job is 15 minutes and less. Or sometimes it's even, I have 2 minutes to walk with a lawmaker from committee A to committee B, and I have to pitch my story, my need. I have to make an ask of them. And so depending on how much time we have, that also limits how much we can or can't share. A couple of things to keep in mind. You're not going to be able to share every single detail of your story, of your experience. And there's going to feel like there's holes, right? You know your story from X to Y, and you know the things that you're leaving out, but not everybody knows as much as you do, right? And so I think really acknowledging that, like, you're not going to be able to say everything you want, which is really hard, but there's always follow-up opportunities. Um, and when you practice your story, telling your story, practice it with somebody else, because when you work or practice with a partner, they can help you remove pieces that maybe aren't essential. They're essential to you, but maybe they're not essential to those kind of questions that you laid out for yourself earlier. And they can help you kind of streamline the point you're trying to make. Stories are personal and emotions are absolutely okay. I will tell my volunteers, if you make your lawmaker cry because they feel such a connection to you, that's a win because they will remember you. And so much of advocacy is about building long-term relationships with decision makers, right? Building that trust, being seen as an expert, as a resource, as a valued member of the community who can be your resource for them. And then finally, and this one is the hardest, it's not enough to be right. We know community health workers are incredible. We know all of the benefits that come from having community health workers out in the field, but it's not enough to be right. It's not enough to know that we still have to go through this political and policy process to get something done. And it's not enough to be right, as frustrating as that can be. So, Sean, I saw you talking about creating an elevator pitch. That is so true. And so we use a tool when we're training our volunteers or advocates um, to help craft a story. So, in addition to those questions, there's kind of the 3 points of a conversation or 3 points of your elevator pitch. And that's the hook, the line, and the sinker. Now, this is oversimplified for sure. Conversations are key. We also know that a conversation isn't Emily saying A, lawmaker saying B, shaking hands, done, right? Like there's sometimes going to be a back and forth. You're going to have to pivot, but the hook, line, and sinker helps you plan out what the core of what you want to talk about is, so you can always come back to that. So your hook is your introduction, your name, your address, why you're here. So my hook would be, hi, Representative Greenman. I'm Emily Myatt. I live in Minneapolis in your district. I am the Government Relations Director for the American Cancer Society Cancer Action Network, and I'm here today to talk to you about a bill that would increase funding for community health workers in our district and across the state. So that's my hook, right? She knows who I am. She knows that I live in the district, and she has a glimpse at what we're going to talk about. The next piece is the line, right? The line is your personal story or talking points about why an issue matters to you. It's kind of building out the case for what you're there to talk about. So it could be talking about how you as a community health worker have taken care of a patient, how you helped connect someone to services that they needed, right? So it's really adding color to the issue. It can be kind of facts and figures. It can be statistics. That's important. But the line is really helpful when it's real life examples because, again, I think at the Capitol, when you're looking at a bill, it is so easy to forget that a bill impacts real people. And so the more we can bring real people to lawmakers so they remember how their actions impact all of us, that's key. So the line is, again, your personal story and your talking points. And then the sinker is the ask. Always have an ask for someone, especially when you're meeting with an elected official. Ask your elected official to do something for you. So earlier today, the Community Health Worker Alliance sent out a call to action around asking our federal members, so our congressional members, our US senators, and our US representative to protect Medicaid. We know that there's lots of conversations happening in Congress about cutting Medicaid to pay for other things. Also, changing the structure of Medicaid by how much funding comes into our state, or potentially imposing really burdensome bureaucratic provisions like work reporting requirements that is only in place to disrupt care and make it hard for enrollees to get the care they need. And so right now, I would invite all of you to take a couple minutes and we're going to kind of maybe just sit in some silence for a little bit and use the hook, line, and sinker to make a phone script to call your member of Congress. So I want you to map out what your hook is, and I'll go back to the hook, line, sinker. But your hook, who you are, the line, like why are you calling? What is the value of Medicaid? What do you see as a community health worker and about Medicaid? Why is it important to the folks you serve? And then the ask is, please do not support any cuts to Medicaid. So here's some talking points, and these were the talking points that the Community Health Worker Alliance created that are very much CHW focused. But you could also, instead of using one of the talking points, have a story to tell. So we're going to take a little bit of time here, and Angela, keep me honest about like how much time we have. Um, but craft and kind of write out using your hook, line, and sinker that elevator speech that you would use when you want to call your elected official's office and leave a message telling them something.
We're doing good on time. We're at 3:53. The session doesn't end until 4:30. So we
Perfect.
can, how much time would you like to slot out for this, activity?
How do folks feel about at 4 o'clock we come back together, and maybe if folks feel comfortable sharing your hook, line, and sinker that you would use when calling your lawmaker asking them to protect Medicaid? Does that sound okay?
That would be nice.
Okay. All
So,
right, so we're gonna like sit in silence for a moment.
mhm.
I'm gonna do this so maybe you can see more of the slides. Um, the hook, line, and sinker, and then I'll keep up this call to action so you can see the talking points a little bit better. And we'll just go from there. How are those instructions clear? How and can I answer any questions? Any additional context that I can add?
They seem to be in focus now, so we can see
I
them.
love it.
And just a reminder that CHWs have a unique position in driving health change, especially during times of shifting health landscape. So we have a significant role here. Let's empower ourselves. So we're gonna take these moments and think for a minute and get our elevator pitch together and then resume. Sean said creating an elevator speech can be beneficial. Absolutely. Absolutely. You always have one on deck.
Of course, Liz. So I'm asking everybody to spend about 5 more minutes crafting your hook, line, and sinker. So the method you would use to kind of set up a phone script for yourself to call your member of Congress and ask them to not support any cuts to the Medicaid program. So you're going to write out your hook, your line, so why Medicaid's important to you or the perspective you see as a community health worker, and then the ask, which is please don't support any cuts to Medicaid. And then we'll come back together in just a couple of minutes. And if folks feel comfortable, I'll ask some of you to share your hook, line, and sinker. We've got about 2 minutes left. All right, we're at 4 o'clock. How do people feel? Do you need more time? Do you feel like this was enough time? Anybody want to share their hook, line, and sinker?
We have one in the chat. Would you like me to read it or you?
I can read it. Okay, so Sean says, oh, Sean, did you want to come off of mute?
No, I don't. There's meetings going around here, so
All good.
thank you.
Okay, so Sean shared, hello, my name's Sean McKinney and I live in Plymouth. I'm a community health worker who for 11 years have supported and advocated for individuals and families that without extra assistance would have otherwise fallen through the cracks. Please do not support any cuts to Medicaid. Any cuts will negatively impact people who need services the most. Amazing. Sean, that was so good. That's perfect, especially for a phone call when you don't have a ton of time. And when you call your lawmaker, it's not going to be the lawmaker that answers, it's going to be their legislative assistant or their staffer. And so they're taking notes. And so this is really accessible. You say where you're calling from, your expertise, right? That you have 11 years of community health workers, and what their impact could be on folks. So that's beautiful, Sean. Well done. Anybody else feel comfortable sharing their hook, line, and sinker?
Is there one more, two more? You can throw it in the chat.
And there's no right or
Or
wrong
wrong.
way to do this. So I just wanted to kind of put folks at ease if this is a new experience for you. So I picked this as the call to action because the Community Health Worker Alliance did put out the ask to have CHWs call their members of Congress. And so that all the info is in the email that went out today, but also this slide and this presentation, right? Showed you how to look up who your lawmakers are, how to find their phone info, how to find their office info, how to tell your story. You can do a phone call. You could write a letter and send it in the mail. You could do an email. An email would give you a little bit more time to have specific examples potentially, but just really kind of wanted to show and make it easy and find easy ways to engage and to kind of share your perspective in the process, because the voice of CHWs really does matter and should be part of this process. Hey, Vanessa.
Hey, I would be willing to share an example. This isn't necessarily my pitch, but we had the opportunity to take some youth from our Substance Abuse Prevention Coalition to DC last year, and we met with US Representative Finstad. And when you talk about the example of stories being so important, the youth that were able to attend had shared with Representative Finstad, like the issue around feeling like they couldn't use the restroom at school because of vaping that was happening in the school restroom. And that just really stuck with him. I mean, he's a parent of 7 kids, and he remembered that, and he went back and shared that story. And they talked about it this year, a year later at the conference, about the impact that sharing that story had with him. And so I just wanted to share that as an example that it matters. Sometimes it might seem like, a funny snippet to share, but if it sticks with them, it just makes all the difference.
I love that so much. I also really love the work you do to empower young people so they can engage in the process from the very beginning. Even if you can't vote, your story, your experience matters because lawmakers represent all of us, right? Like it doesn't matter if we can vote or not. And so I love that shifting of power. And I also just love that real example of how like what might feel day to day or mundane for you and I is a new experience for that lawmaker that they weren't aware of. And that's what advocacy and storytelling is all about, is shifting that power and reminding lawmakers that like, you don't know everything. I'm an expert on my story, my experience, and you should keep that in mind as you're making important decisions that impact me and my community. Thanks, Vanessa. Love that.
Absolutely. Thank you, Vanessa. And so, as from a CHW perspective, by incorporating the power of our storytelling into public health, we aim to highlight those real life experiences and their perspectives from CHWs in advocating for changes. So our stories have the power to humanize that data because they're reading graphs, they're reading charts, they're reading numbers, they're reading reports. And so we provide those evidence of our own impact in real time. And because we're sharing these grassroots realities of working as frontline healthcare workers. And so our stories are so crucial in shaping, policies that reflect the needs of the communities, especially those that we serve. Yes, definitely. And as Vanessa pointed out, it's those stories that resonate, that sticks with someone and someone shares it and it sticks with that person. So those connected pieces is important.
And stories are a way to show different lived experiences. Because lawmakers sometimes think that because I haven't lived it, that's not the case, right? They might hear a statistic and find a really easy way to dismiss a statistic. But a lived experience, a story, a reality is harder to dismiss. It can still happen, right? Like, I don't want to pretend like you tell a story, you're going to change a lawmaker's mind and heart. But it is a way to, through empathy and reality, try to shift that dynamic and to have a conversation. And I will say, nearly every time I meet with a lawmaker, it is never combative. It is, they might disagree with me, I might disagree with them, but we keep a conversation going just as humans do. I feel like we watch the news, we read the news, we see things on social media, and it's like the worst of the worst. And like to Sean's earlier point about like, I've always had like a bad thought when I think about lobbyists, right? Like, but the reality of things is a little different. And so I think the more we can keep bringing people to the Capitol, empower folks to share their stories and experiences, we're having real conversations, just like we do in our communities with decision makers, because they're people, they put their pants on the same way we do. They shouldn't be on a pedestal, right? Like they're just one of us and we're one of them. So I think stories are a really way to kind of shift power. And I know I keep saying that, but it's the truth.
Absolutely. And then being in spaces and allowing yourself to be comfortable in those spaces. Because it was a bit intimidating in myself visiting the Capitol, talking to representatives and officials. I've went in formal capacities as well as informal capacities, but those informal capacities gave me the momentum, gave me the courage to be able to address and be able to rise to the occasion for those formal capacities. I've testified for the House and the Senate throughout my career. I've also been there for rallies, day at the Capitol. So the more and more I'm able to be in that space, it allows me to feel a little bit more comfortable, and it also allows me to say, hey, I deserve to be in this space and my voices need to be heard.
Love that. That's true. And I also want to say that my job is to make it easy for my volunteers to engage in the process. And so I'm really happy to keep working with Angela and the Community Health Worker Alliance to do that for you all. So if there's an opportunity to testify, really happy to work with individuals to say like, okay, here's what the process is going to feel like. Here are things to remember. You can absolutely read from a script and notes. You don't have to be off the cuff or have it memorized. I can kind of walk you through the protocols of it because it is beautiful in that in some ways there is this kind of protocol to the process. You talk to the chair, like that. It has this decorum that can be really lovely. And so I want to help folks kind of navigate that. So just know that like, I'm happy to be a resource. I know Angela has incredible experience and is a resource too. And we want to make it as easy as possible for you all to feel like you can and can engage in the process.
Absolutely. Thank you for that invitation. And I wanted to share with our group here is that the Alliance has created and launched and facilitated by myself a CHW Advocacy Advisory Committee. It's newly formed, and it's a group within the Minnesota Community Health Alliance. It's designed to amplify the voices of CHWs, the workforce, and advocate for policies and practices that promotes the sustainability, the recognition, and the empowerment of CHWs across Minnesota. The committee will serve as a key platform for CHWs to provide input and guidance on initiatives that impact our workforce, the public health practices, and health equality within the state. So we found that it was valuable to incorporate power or in CHWs to tell their stories in a public health setting, to highlight those real life experiences like I spoke about before. The committee just launched this January, so I think we're like officially launched. I think we're like 3 or 4 meetings in. Pardon me, because we've been going through the developmental grassroots of it. So we do have some founding committee members. I think one of them or 2 of them may be here today with us today. And so we're developing the programming logistics and various components of the program. So our purpose and our goal of the committee will focus on the key areas to support and elevate the CHW workforce. Our mission is to amplify our voice by advocating for our workforce to ensure fair compensation, recognition, and integration into health and public health settings. We will leverage our CHW storytelling to humanize public health data, to shape policies and advance health equity, while also strengthening the statewide network of CHWs through collaboration, through training, and as well as leadership development, because this is a form of leadership development. We're going out and we're talking to leaders, so this is a form of leadership development. Our vision is to empower and elevate the role of CHWs in Minnesota, ensuring that our contribution to public health is recognized, is valued, and is integrated into systems. So through advocacy, storytelling, to produce policy change. So we're committed to supporting the sustainability of the CHW workforce. And so we'll be hosting a series of workshops to design to equip us with the essential, we're not saying that we're professionals, but just with the essential advocacy skills in a peer setting to empower each other as we represent our workforce. So the goal is to learn about bills and policies that are specific to our CHW workforce, to learn how to tell our public health story in a more intimate setting. We have developed the guiding principles for the committee and other components of how we would like to see the committee moving forward. So we talk about what is a bill, the Minnesota legislation, understanding how bills and laws affect the CHW workforce, our storytelling skills. So we will be practicing back and forth. We will talk about billing and reimbursement and how that's tied into bills and statutes and various things and how that affects our workforce. We will talk about community engagement, so those formal, informal interactions that Emily spoke about today in her presentations of how to connect with officials and know who represents your community or the community of those that you serve. And so it's just a organized space. So anyone is interested here, please reach out to me. We meet bi-weekly on Tuesdays at 4 p.m. And so we kind of been just formulating the program and coming together. It's been coming together very nicely. Also, there's resources and access to information. When you hear such things as mentioned today about the call to action about Medicaid, we talk more exclusively in those groups amongst ourselves. And we want you to bring your thoughts, your resources to that space. Again, I'll pop my my email in the chat before we end. We have someone coming back in before we end, so you can reach out to me directly if you want to sit with me and have like a one-on-one and talk about the program's ins and outs. So we're right at 4:15, and I'm just gonna shift gears a little bit. And as I also put in the chat, the CHW Learning Institute will be starting for the 2025 year, and then it will be starting on April 8th, 2025, and it will be running through September. The first session and the last session will be in person, so the orientation will be an important in-person meeting. The other meetings throughout that time will be virtual, and then upon graduation, we will come together. So it's a statewide initiative, and we're trying to find a central location so that everyone would be able to take advantage of that opportunity. So feel free to follow the link. I'll pop it back in the chat again on where you can apply. Also, the Alliance, as Emily talked about, we released a call to action for Medicaid cuts, but also aligning with that, we are also rolling out some upcoming training for CHWs for February 27th. And so save the date. I'm hoping to have everything formalized and sent out by the end of the week. We have a lot going on. And the topic of that training will be around responding to shifting situations and how CHW impact to help and respond to the evolving community needs. And so that training again will be on February 27th, and it will be from noon to 1:30. We're going to have a rich panel, that would bring their expertise and perspectives to that space. I will be the facilitator and moderator of that training, so feel free to join us there. I've entered into the chat to save the date for that. And so that concludes all of our announcements for the day. I can bounce it back to Emily if she would like to close us out for our session.
Thanks everybody for just your time. I know at some points it can be a little boring potentially. I am really a nerd. So I love policy. I love my job. I love what I do. But I really appreciate the chance to kind of share a little bit more about how you can engage in the process. And I know we have like 23 minutes, or 13 minutes, sorry. So if any math is not my strong point, that's why I do words for a living, not math. But if anybody has any questions, has any experiences, has any policies they want to flag, like really happy just to have some kind of conversations and talk about things you all want to talk about.
This seems interesting. Thank you so much. That's from Sean. As advocates for change, in closing, CHWs play a vital role in advocating for change, especially in healthcare and public health settings. We are often the front line of health and wellness and working directly with the communities to close these gaps between health systems and underserved communities. So just as advocates, we promote health education, we improve access to care, we advocate for policy change, we build trust, we address social determinants of health. So And as I summarize this session together, we are powerful advocates for change, both within our communities and a policy level, improving health outcomes and fostering more equitable health systems and social systems. Yay, I love the hearts. So it was wonderful spending this time in this learning space with you today. Once the recording gets edited, it will be sent over to our communications department. We'll get it released. Please reach out to me for any resources that you may be needing or any follow-up information from our time together. Are there any closing questions? Any comments? I do have, if it worked. Everyone says thank you so much. Let's see. Save. And so we can close out our day together. I will, uh-oh, I'm in screens. I keep popping through screens. We will close out our meeting. Our meeting is officially adjourned. Everyone stay warm and dry because I think there's more snow and cold coming our way. And snuggle up, and thank you everyone for coming.
Thank you. Take care, everybody. Be well.